Hey mama, it's so exciting to get that first sense that labor is beginning and that you are making your way on your journey to meet your baby. But sometimes labor seems to start and then stop and then start and then stop. This can be very tiring and frustrating, especially as you are at the end of your pregnancy and you just want to meet the little person that you've been growing inside you for the last 9 months. So in this video, we're going to cover some of the reasons labor might start and then stop and what you can do to keep it progressing. I'm Bridget and I'm a childbirth educator and birth doula, and it's my passion and honor to support women just like you to trust that they are built to birth. If you're new to the Built to Birth YouTube channel, then subscribe and hit the bell so you don't miss any future videos that come your way. Giving birth for the first time is a pretty unknown journey, and since every birth is different, even if you have given birth before, things might be different than you expected. So by the end of this video, you're going to have the information and tools you need to know if labor throws you a curveball by giving you those start and stop labor symptoms. So before we dive in, I want to differentiate between pre-labor and start and stop labor. Pre-labor is marked by labor sensations that come on but don't grow in intensity or frequency. So maybe at 37 weeks, you start feeling crampy, have a low backache, or having some contractions that are definitely stronger than Braxton Hicks, and they are coming once every 10 minutes or 20 minutes, then 5 minutes, and are sort of all over the place and then fade away. This is considered pre-labor, and you can tell the difference between pre-labor and labor by the intensity and frequency of the contractions, or as I like to call them, surges. Pre-labor surges over a period of time do not really grow in intensity or frequency, so they don't really get too much stronger and they don't consistently get closer together. Pre-labor can last for a few days or even a few weeks before true labor sets in. Now, true labor is marked by similar sensations as pre-labor, but the surges grow in intensity, duration, and frequency. So those cramps, that backache, and surges will, over time, get more powerful, will last longer, and the time between them will get shorter and shorter. And this is really exciting for mama because it seems like labor is getting somewhere when all of a sudden things seem to stop and the surges become shorter and way less frequent and not as powerful. So one of the reasons for that could be exhaustion. If mama has been up for a really long time and her mind and body is fatigued, labor is going to have a harder time picking up and progressing. So one of the best things that mama can do is to get some good solid rest. If trying to sleep on your own seems next to impossible, mama, you want to talk to your care provider and see what options you have to get some rest. Sometimes Benadryl is given to help mama relax and the drowsy effect makes her fall asleep. Sometimes morphine is given in small doses to help mama knock out for several hours. Now, morphine is a really powerful drug, so it really should be used as a last resort option. Morphine does cross the placenta and reaches the baby, and studies do show that infants whose mothers use morphine in labor move less during the shelf life of the drug, usually for 8 to 12 hours. Plus, care providers will only use this early on in labor because babies born under the effects of morphine are less responsive and typically have more trouble breathing. Otherwise, getting into a warm tub can oftentimes help mama relax if partners are in there with mama or carefully watching mama. She could even doze off while she's in the warm water. Oftentimes, when mama awakes with renewed energy, she will be ready to welcome labor and things will progress. Another reason for start and stop labor is that mama is not eating and drinking enough. Labor is hard work, and if you aren't getting the nutrition that you need to fuel the process of birth, it's again going to make it challenging for things to progress. Eating and drinking frequently throughout labor allows mothers to fuel their bodies that are quickly using up energy as labor progresses, and women are generally very intuitive about how much they need to eat. Typically, as labor progresses into the more powerful phases, women typically eat much less and only to sustain their energy. If you want some more information on eating during labor and which foods provide good nutrition and energy during labor, check out this video that is linked up here. The third reason for a start and stop labor is mama's mindset. Mama, your mind is such a powerful tool in your labor and can be used to help or hinder the birthing process. And a lot of times you're not even thinking about how it's working either for or against you. Birth begins in the brain, and in order for things to start and progress, your mind must feel safe, confident, and in control so that it can have clear communication with your body to keep leading it in the direction that you want it to go. If your environment, your sensations, or your thoughts seem chaotic, fearful, distracting, or tense, it's likely that your mind and your body are disconnected from each other and need to get back on the same track in order for labor to progress. Oftentimes, before the cervix has reached 5 centimeters of dilation, a lot of work that needs to be done to help the physical progress of labor to continue is in the mind. Mama needs to be in an environment where she can feel totally safe and free to do whatever she needs to continue laboring. She needs encouragement from her birth team. She needs quiet, privacy, and darkness. I talk 5 elements of a calm birth in this video that if you haven't watched it, I 100% recommend because it's going to help you create a space that allows your mind and body to be at ease and connected to each other to complete the process of birth. You can also access the Built to Birth affirmation meditations that guide you through labor and keep your mind and body working in harmony with the other. And if you want to access those, you can either watch them on my playlist on YouTube or download them through my website, builttobirth.com. And I'll have both of those links down below in the description. Where your mind leads, your body follows. So I encourage you to use those guided affirmation meditations to lead you into and through your birth experience. Now, the fourth reason that labor is starting and building and then suddenly stopping is because baby is not in the most optimal position for birth, which means they aren't putting the best pressure on the cervix to keep labor going. A lot of times we'll see this start and stop pattern in labor when a baby is in an occiput posterior position, which means the back of their head is on mama's back instead of it facing and pointing towards mama's back. In this position, in the OP position, baby has a more challenging time navigating this big bone right here to allow them to descend and put adequate pressure on the cervix. So how do you know if baby is in an OP position? Well, you can have your care provider check for you by either doing an ultrasound like they often do in the weeks before birth and ask them what position baby is in. And you want more than just head down, because a head down baby could be facing the back, which is common and optimal for labor, but it could also be facing the front or in a sideways sort of position known as transverse, which you would want to know ideally before labor begins, but at least in labor. You can also find out by getting a cervical check where your care provider can feel baby's head, and depending on what parts of the skull that they feel, they can tell you if baby is OP, transverse, or anterior. And anterior just means that they are facing mama's back and the back of their head is on the anterior part of mama's belly, which you want. And then the last way that you can check your baby's position is all by yourself. You'll want to know where their back is, which you can find out by feeling the round, hard area on your belly. Then where you notice the most kicks, because that will tell you where their feet are. And then if you feel any flutters, that's likely where their hands are. And if baby is head down, you're probably going to feel those flutters down lower. If baby is in an OP position, many of their kicks and flutters will be felt more on the outside of your belly. So maybe you'll see them here in the side or the front or the other front side, or maybe you're going to see them directly in front. If they are looking directly out with their head on your back, that's where you're going to feel those front kicks and flutters. Now, I don't want to spend too much time going into detail about belly mapping in this video. Maybe that will be a future video, but I will link down below the Spinning Babies website that shares how to belly map to figure out the position of your baby. So to help get baby into an optimal position to stop that start and stop labor and continue progressing, movement is your friend, and there are a few movements that can help a lot. The first one is leaning over a birth ball to help encourage baby to rotate out of of that head on your back position, you want to use gravity to your advantage, and leaning over a birth ball can help you do that. While you're leaning over a birth ball, moving your hips in a circular motion can allow room in the pelvis by changing the position of your sacrum to move it out of the way a little bit so that baby can move their head a bit easier. Another position that you can do is the forward leaning inversion, which I explain how to do in this video linked up here. And the forward leaning inversion opens and releases the lower part of the uterus where your baby's head is to help create more space to allow them to turn around. Now, to do the forward leaning inversion in labor, it's typically best when done through one contraction and then once again 15 minutes later through another contraction. But if your surges are very irregular because you're in that stop phase, then just hold it for about 30 seconds and then do it once again in 15 minutes. Lying on your side with the top leg draped in front of your body can also be very beneficial. So instead of lying on your side with your legs stacked on top of each other, straighten out the bottom leg and then bend the top leg, the top knee, and then bring the top leg over in front of your body so that it's resting on the bed, couch, or floor. With this position, you want to try to lay on the opposite side that your baby is on. So if your baby is in an OP position, more on the right side of your belly, you're going to want to lay on your left side with your right leg bent and draped over so that you're using gravity to help get them to turn over. If your baby is more on the left side of your belly, then you're going to want to lay on your right side to help gravity move them over. Now, these are just 3 movements that you can do, and there are so many more that you can learn now and utilize in labor. In my Built to Birth online class, I teach you step by step so many movements that you can do during each phase of labor from beginning to end to facilitate labor. And then on top of that, you also learn positions specifically for circumstances that arise in labor that make labor difficult if you stop dilating or if baby is not in an ideal position for birth. And a lot of times you don't know those things until you are in labor. So if you're pregnant and watching this, please go check out the Built to Birth online course, learn about movements in labor, lunges, rebozo sifting, open knee chest, sideline release, and so much more, because what you learn in this class during pregnancy can save you from having to YouTube or Google what to do if labor has already begun and starts throwing you curveballs. Mama, if you are in labor now and you're having a challenging time, don't worry, you've got this, I promise. Take a deep breath, use the movements I just taught you, try to get some rest, eat some food, drink some water, go download the Built to Birth affirmation meditations to calm your mind. You are going to meet your baby so soon. Mama, whether you're pregnant or in labor, as you're watching this video, I hope you are feeling more encouraged, informed, and empowered than before you started watching. So thanks for being with me in this video, and I will see you in the next one. Bye.